Foot surgery for vanity. The latest trend in plastic surgery, the obsession with perfect feet.
3 out of 4 Americans will have trouble with their feet sooner or later, but for some, it's not how their feet feel that matters, it's how they look. And many people go under the knife just to get that perfect look from the ground up. 2 operations under general anesthesia, surgeons using bone saws, total cost up to $10,000, all to feel comfortable in sandals like these.
I was just so thrilled.
You're looking at an extreme makeover for feet. Newport Beach podiatrist David Lee specializes in cosmetic foot surgery.
There are some patients that have a significant psychological impact upon the way their feet look.
In one of the most common fix-it procedures,
a short toe becomes a long toe.
Here's the problem. It's called Brachymetatarsia. Happens when a toe bone called a metatarsal stops growing in childhood while the rest of the foot grows normally. This patient is so ashamed of her feet, she wouldn't let us show her face. Donna Saylor, who had the same condition corrected 6 years ago, explains.
Exactly. Shameful is a good word.
From the time she was 8,
never wore sandals, never went barefoot. It was really an embarrassment for me.
To create a more attractive slope to the toes, Dr. Lee opens the top of the foot to get to that short metatarsal. Then,
basically, I will cut the bone in half.
He pulls the top of the toe longer.
And then insert a bone graft into the middle to hold it in place.
You can see the result right on the operating table. A foot that started out like this comes out of surgery like this. Then the hard part begins.
3 months in a cast recovery with another 2 months of just regular walking and no jumpings.
And since only one foot can be done at a time, the whole ordeal has to be repeated. But despite all that,
it was wonderful. No turning back.
After a lifetime of hiding,
pedicure right now, pedicure feels real good. It's normal. Makes me feel good. Makes me feel complete.
Dr. Lee says once recovery is complete and the bone is healed, patients can do pretty much everything they did before, even running and jumping. That could take, though, 5 to 6 months.